You've just seen a demonstration of a method for giving bad news. There are a number of useful points to pay attention to. First, right at the beginning, you'll see that the physician starts the discussion by assessing what Mr. Hawkins knows or perceives about his medical situation. This is the P of spikes.
Good. So no major problems after the biopsy then?
No, not really, Doctor.
Okie-doke. Now, before I go into the results and so on, why don't you tell me what you understand about the situation, what your family doctor told you, and what Dr. Wilson said to you before the biopsy?
The assessment of the patient's perception benefits a great deal from a few key strategies. Note the physician's use of open-ended questions, such as, "Why don't you tell me more?" in order to explore the patient's perceptions. He subsequently then uses reinforcement or approval of what the patient says, then repetition of keywords, and then more direct questions about what Mr. Hawkins was thinking.
Well, he said that the blood work was abnormal, I think the word he used.
Correct, that's correct, absolutely.
But then he carried on, he said that he wasn't sure about the prostate at this point. He could not tell at this point.
He couldn't tell?
No.
In your own mind, were you thinking it might be something serious going on in the prostate or something not so serious?
No, I thought it wasn't all that serious. I mean...
It didn't strike you as something serious?
No, I thought maybe the blood work.
The doctor now has an important piece of information. He knows that Mr. Hawkins may be unaware of the seriousness of his medical situation. And so the bad news would probably come as quite a shock. This allows the doctor to prepare for any emotion that will likely occur.
No, I thought maybe the blood work, someone had missed it, or... But,
okay.
Yeah.
Now, if it turns out to be something serious, would you like me to tell you exactly what's going on in the prostate and how we plan to treat it?
Permission allows the patient to decline the information at that point. For whatever reason, he may not feel up to it, or he may want to have his family members present for the discussion. It's also a signpost for setting the goal for the subsequent conversation. You'll see that next the physician explains the diagnosis, connecting for the patient a chain of events from the biopsy to the present disclosure, and this allows him to transition psychologically from being well to being less well. It also grounds the information in the patient's own experience, which helps him grasp it better. Notice that as the doctor does this, he checks along the way that Mr. Hawkins actually understands what's being said.
That's correct. And that's why Dr. Wilson took those pieces of the prostate, the little biopsy specimens, to see what was going on. Because sometimes that blood test is high and it's nothing serious, sometimes it's something more serious. Okay?
Oh, I see.
You with me so far?
Yes, I am.
And as he continues with the explanation, relating the news or the knowledge, the physician observes for and acknowledges any emotion that arises. The E of spikes, standing for emotions, always follows closely behind the K for knowledge. A simple empathic response to the patient's emotion, such as, "That is obviously a shock," is a very compassionate way of aligning with the patient.
In your case, Mr. Hawkins, it turned out that indeed it was, unfortunately, something more serious. In fact, in over half of the pieces that were taken out of the prostate, the cause or the biopsy pieces, there was cancer in the prostate. That's obviously a shock.
Yes.
After the explanation, the K for knowledge, and with the E for emotions, patients may feel somewhat bewildered or overwhelmed, so it's really important at the close of the interview to make them feel that they can ask more questions later. And don't forget, at the close of the interview, that family members are a major part of the support system for the patient. So if there's no one accompanying the patient at that juncture, ask if they'd like to bring someone the next time. It will actually make your job easier.
That's a lot to take, isn't it?
Yes, it is. Yes, it is.
If, by the way, and this is important, if you want to bring your wife or any other family member to any of the visits with me, no problem at all.
Okay, I'd like to bring the wife, actually.
Would you?
Yes.
Sure. And one last thing. Probably by the time you get to the car park, you'll have about 30 questions going through your mind. It's always the way.
I've got that nearly now.
You see, okay.
Yeah.
Don't hesitate to write those questions down on a piece of paper
I will.
and bring them along next time.
Here you've seen one common approach to giving bad news. The major pitfalls in this kind of interview are all related to not taking the time to get the steps right, such as choosing a poor setting where there are distractions. Also, if you don't ascertain your patient's perception of his situation right at the beginning and along the way, much of what you say might be lost. And finally, there will usually be emotion. The thing is to recognize that and acknowledge it. Don't try to counteract it with information. If you don't acknowledge emotion, the whole interview may come to cross purposes. Breaking bad news is a very complex task. Because physicians do it many times over the course of their careers, it's valuable to have a strategy that produces a supportive atmosphere for the patient.